Thank you guys all for coming here today. We'll be talking about balancing behavioral health treatment and cultural awareness. My name is Ariel Thompson. As Claudia mentioned, I'm a clinical supervisor with Catholic Community Services Family Behavioral Health. Within the WISE program, I oversee our Spanish-English bilingual teams. I've also provided specialized therapeutic services to the Latino community for over 7 years.
Hi everyone, and just to make a correction, small correction, my name is Cesar Linares. I am not a clinical supervisor. I am a clinician at Catholic Community Services. And can we go on to the next slide? And just to add a little bit, I have joined the Masters of Social Work program at UW. Because for me, it's really important, mental health, especially mental health with my immigrant community. There's a lot of different things that are coming up, and I think it's a new field, and so for me, it's really important to be equipped. And while I'm not a supervisor, I am hoping that in the future I can keep growing in the company and just expand my skill set. And to begin with the first slide, so who we are, we serve children from birth to about 21. We serve families across all of Washington State, so King County, Pierce County, Vancouver, up in Bremerton. We support families that have youth that are experiencing crises, and sometimes for families it can be a difficult time to help their kid get through that crisis. Usually families know what their kids need, but maybe they just need a little bit of extra support, and so that's what we come in to do. We help families navigate crises, and so for how long they are with us, it depends on family and youth need. It can last from about 6 months to a year for each family. Our teams consist of a clinician, a parent peer, a care coordinator, and a youth peer. The parent peer and youth peers work specifically with parent and youth just around what they are navigating in services with us, but then other systems that they are having to encounter as well, and just to process with them what it's like to go through that. We provide crisis intervention and stabilization services for family, and so, as I mentioned, it's about 6 months to a year. Sometimes it can vary depending on the family and the need. And we do provide comprehensive, family-centered, wraparound support care. So we work with the schools, we work with the medical providers, and any other systems that the family is encountering. We are a Medicaid-funded WISE service, and we also, well, Ariel, maybe you can speak to that later. Our approach is that we are bilingual and bicultural staff. I would also include multicultural staff. And the way that we work with families, meet them where they are. We try to be culturally responsive, culturally relevant, and really hone in on the strengths of the family in the treatment. And family voice always leads the care plan, and that's very essential to the work that we do.
Perfect. So moving on, you'll see on this slide, on your left, there's a list of common Latinx cultural values, and then on the right, we have our family behavioral health guiding principles. So you'll notice a little bit of overlap in that they definitely go hand in hand, making our approach really ready and available to serve the community. So you'll see, for example, familismo, so emphasis on family, loyalty, closeness, and responsibility. For us in our guiding principles, being family-centered. So we really realize that the well-being of kiddos is so tightly connected to the well-being of their parents. So kind of focusing in on a comprehensive service, we really work to stabilize and grow skills, not only within the kiddos themselves, but also with the parents and any other caregivers, so like an abuelita or tia or tío. Within their community to be able to better navigate crisis within the family. Moving on, we have personalismo, so warmth, personal relationships that are valued. Within the guiding principles, we have flexible. So we meet families based on their schedule and their need. We might show up to a house at like 8, 9 at night with a pizza, right? Again, to try to sit down and process what the family's day has been, what are their needs, what have been some of the barriers and hiccups during the day, and how can we work for a better tomorrow. In addition, right, our services are very much individualized, so we can do a range of service from individual sessions to group therapy to family sessions. We also meet families in the home as well as out in the community. So we really have this non-traditional approach to, again, best meet our family's needs. Next, we have respeto, so respect for elders, authority, and roles. When looking at our guiding principles, you'll really notice that we take a strengths-based approach and we're also family-driven. So in relation to strengths-based, we always want to try to highlight the effort and the positive aspects of a family. So what are the seeds that we can grow within this family? We're not starting over, we're not, demolishing and putting in a whole new thing. We're really working with the family to build. And then in addition, so family driven, back to tapping into that wisdom of the family, the generational wisdom, the parents who have been there 24/7, right, with the kiddos. We understand that the parents, right, are really the ones that are going to be the experts in their own stories, and they're really going to be able to guide us with our therapeutic approach of like if something's actually doable or if we need to revamp it, rework it to actually make it applicable to their family. Moving on to our last cultural value, we have fatalismo. So, right, this idea, this belief that life events are beyond personal control. When we are looking at the guiding principles, we see unconditional. So no matter what's going on, we are meeting with the family, right? And we're meeting the family where they're at. We understand that in society today, how, issues can be so complex. Again, families are just trying to make it work. So no matter the decisions that have gotten them to a certain place, we're always going to be trying to work for that better tomorrow. In addition, right, like when we're thinking about back to complex systems, so racism and just all the barriers that kiddos and families may face, right, we might not be able to remedy those bigger systemic issues. However, we can work with the family to grow skills to be able to resist and then also flourish within their own family. Next slide, we're going to be looking at some common barriers that myself and my teams have noticed when working within the community. So starting off, we can see a lack of knowledge of rights. When we're looking at the immigrant population, right, coming to the U.S. and the U.S. having their own unique system for healthcare, it can be really confusing. I know for myself and my family in Lima, Peru, when you're feeling sick, when you have a need, you typically can go to the hospital. That's like kind of your one-stop shop. When you come here to the U.S., we've got the ER, we've got urgent cares, we have specialists. We have just a wide variety of places that people can go, but you have to know where to go in order to get that help. So luckily with our WISE teams, we're able to support families to be able to connect. Next, we also have a fear of accessing services that really may affect immigration status. So when a family is going to try to formalize their documentation status, there is the real fear of like, oh, we're going to get this mark that we've used a service and we're not going to be eligible to formalize our status. And so within our teams, we really do try to educate that here in Washington State, kids who are financially eligible can enroll in Medicaid within Washington State. And through Medicaid, you can get access to WISE services. In addition, right, so again, we provide wraparound support. So when we are working with families, we're really understanding of what resources families are going to be able to access and which not so much. And we are always very sensitive to that because we understand that families may have, knocked on a lot of doors before coming to us, and it can be very self-defeat, it can be very this feeling of defeat when you've knocked on so many doors and been turned away. Now, moving on to kind of the flip side, so lack of access to knowledgeable providers. So I know for myself and my own education, all of my education, so I studied here in the US, and so all of my education was in English. So that meant that when I started out in the field, a lot of my experience was, really built up in English, but not so much in Spanish. And when you're looking at therapeutic services, I know in my classes, when I've had practice, I was really primed, for certain phrases to be able to really explore certain topics. But I didn't get to have that practice in Spanish, right? So when I was out in the field, it was me flying solo, doing my best, and really trying to learn, okay, what are those things that I need to be specifically listening to kind of pick up to address barriers. In addition, so when we're looking at Spanish-speaking families, Spanish-speaking parents, when families try to access services, especially English-speaking services, that is one more barrier of trying to communicate. And if an organization is able to even schedule an interpreter to be able to meet with the family, that's that one step that I've seen so many families slip through the cracks of oh, were you able to talk to this organization or this one? And it's, oh, well, we're waiting for them to schedule the interpreter, and now we have to all be available at a certain time to be able to have that meeting. And then in addition, when families are even able to get in and have that meeting, when we're talking about translation, that's also taking up time. So when schools or other systems give you an hour for an English-speaking family, you get an hour of really being able to dig into issues and really be able to explain needs. With a Spanish-speaking family and a translator present, that's taking up almost half of the time, being able to just translate. So then Spanish-speaking families are really forced to try to address issues in half the time. Then moving on, we also have financial hardship. So, while there are definitely worker rights here in Washington State, we've also noticed that a lot of employers kind of, tiptoe and take advantage of families' fear of being reported, of being able to access certain rights. When you think about days off, to be able to go to kids' appointments, to be able to meet with the schools. It can get very challenging, and so luckily for us at WISE, we're able to again have that flexible schedule. If family's off, in the morning, that's when we'll come in and have a session. If it happens to be 7, 8 o'clock at night, we're also headed out to the home to meet, because again, we understand that really intense barriers, and at the end of the day, if you're trying to put food on the table, we don't want to interrupt that. Then again, kind of hand in hand, there's mental health stigma. This feeling that oh, I don't want to be marked. I don't want to have something wrong with me. I'm fine. Because again, if you're just trying to meet basic need and try to get to the next day, it can be very overwhelming to think, oh, I have this one more thing to do. And then in addition, from talking with families, we've also noticed this association of oh, if I'm doing mental health treatment, that means that I have to get medicine. And luckily with the WISE teams, that while that absolutely is an option, it's not the only option. There's a wide range of modalities of therapeutic supports that we engage in first before offering the medication option. And then also, like, we have a bilingual med provider who is so welcoming, and he's always up for having a conversation with the family to explore if medication is the right option for them without any pressure. So then moving on to the integration of culture to develop trust. Again, when a WISE team gets through the door, we understand that families may have been really hurt by previous systems, by previous services, whether it was a disconnection or just not a meeting of cultural values. So we really put in that extra time to hear the family stories, and also luckily because we are a multicultural team, we may also relate to some of those stories. We may also already kind of know some of those unspoken rules within the family because we ourselves grew up in that system, right, in that environment. So then again, right, that ability to build that trust, to build that connection with the family. In addition, I know I previously mentioned it, but we really do appreciate families, their history, their own generational wisdom, and we really try to pull that out and highlight it because we understand while a family might be weathering the storm in the moment, there were years and years and years of positive interactions, positive outings that we definitely, again, want to highlight. And see how can we get back to that point. And then, so we also really, again, back to that, like, building trust with the families, being very patient, meeting families where they're at. You'll see in our photo, we have one of our amazing clinicians, Maria Sofia. She's teaching some of the youth and the parents about Dia de los Muertos. You'll see the ofrenda with the cempasúchil, the papel picado, and some of the photos of the family's loved ones. And when we think about these ceremonies, these traditions, right, so while it's absolutely a fun time for kiddos to spend with their parents, we also think about what is that generational wisdom that we're calling forth within the parents as they smell the cempasúchil. What are the memories that are being called forth for the parents, and what are they sharing with their kids, and their kids being able to bond with them, to be able to have this happy evening, right? When we're able to have kiddos that are connected with their parents, we're able to build strong, confident kiddos.
And then on to our next slide. And so just to talk about the impact of services, I think as Ariel and I have spoken about some of these things, when we are able to work with families and really engage in this work with them, we see that it has an impact, a transformative impact for families in their lives and how they live their lives. One family that we have worked with in the past, mom was just dealing with a lot of issues with family members being in the hospital. And so we had to had to figure out how we were gonna meet with mom and family to do therapy. For them, it was just like doing therapy didn't seem like something to be thinking about at that time. And the way that we approached it was just showing up to the hospital, showing up to the family consistently, letting them know that we were there, that we weren't there to like pressure them to do anything, but just simply showing up. I remember one time I showed up and just brought like some activities so that they could do yoga and like move around in the hospital. They weren't really down for it, and that's okay. We always look for other things that they might like. And so it was just a matter of like consistently showing up, asking them, also listening to them. As Ariel mentioned, just like around medication, that was a conversation that we also had to have. And so it was also an opportunity to talk with them about like, what does it mean to take medication? And if anything, just like have an opportunity to have a conversation with someone from mental health services, from services that can talk with them about it without making them feel like bad for not taking it or making them feel bad for not knowing about what it's used for. And so with the family we worked too, daughter was in the hospital a lot too, and so we were meeting little girl in the hospital, trying to support her to be successful in school. Also, she was just kind of navigating her own emotions, and then so we had to we were supporting her with that because we knew it was going to be really important to help mom to kind of get through that stress and through a really stressful time. We also supported youth to get to school and to graduate high school. He was also able to look into, his cousin was able to look into the Puget Sound Skills program, but he was also really interested in college, and so we were figuring out what would it look like for us to really follow family's lead in such a complicated situation. And I think just by walking with family, mom could see that she could trust us. We had to have conversations about mental health and what we were there for. But sort of through that journey, we were able to really walk with the family in their healing.
And so thank you guys so much for listening to our presentation. We do have a booth outside. So if you are interested or have any questions about the WISE program, feel free to visit us out there.
We maybe have time for a couple questions. We're waiting for the next presenter to come in, so we have a little time. Want to ask you, have you seen an impact in the youth that you serve? Are youth who had they're emotionally activated. They have a lot of different issues. Have you seen any bigger impact with all the ICE activity with the families and fears? How you see any impact in the families that you serve?
Absolutely. I definitely noticed. So again, when we're thinking about what kind of environment promotes a healthy child, right? The ability to connect with community, the ability to play, right? And if a family is feeling fearful when they're out on the playground, if they're even feeling fearful to be able to leave their house, that is directly impacting the well-being and mental health of our kiddos.
Yeah. Do we have any questions before I move to a next question? Any questions from the audience? Anybody? Yeah, maybe another question that I was pondering is about, so your system appears to be very flexible. You out in the community, you go visit your families, you do services what they need in the place they need it. Do you encounter barriers or difficulties when you're trying to move the youth into a mental health system who usually operates in an 8 to 5 with an intake, assessments? A lot of the services happen in the office. Do you face barriers to get families into services after being served by WISE?
Like
the transition to a different continuum of care, a different level of care.
Yeah. So I mean, as far as like that meeting, like trying to find a matching service, like absolutely, we're a little bit unparalleled. However, luckily with our wraparound approach, I've personally found that we refer a lot to more informal systems rather than like the formal mental health system. If it's needed, we absolutely will refer to outpatient therapy. However, we've also relied on like Big Brother, Big Sister programs to again provide that mentorship. As well as like other internship programs. I know like the LCA, we have a partnership, and they themselves also have a wide variety of programming. For example, BIFL, so the Building Industry Future Leaders, so more of that like job readiness skills. And while that's the focus, there's also this aspect of being in community with people who share your story, which also again fits that need for the youth and families.
That's fantastic. Fantastic. Anything else? We have a question.
Yeah, I have a question about how do y'all navigate confidentiality and treatment for your clients, as well as the support roles that you have that go to help support clients? Like, how do y'all navigate that balance?
Yeah, absolutely. So our go-to answer is that we have releases of information. So basically, we're always checking in with families around what their comfortability is in sharing. I know that when teams have gone out, right, we do check in with youth and families around like, do they feel comfortable with us like wearing our badges? Or if we're out moving in the community, maybe playing basketball at the community center, how are we introducing ourselves to others when their peers might like ask us? So again, we're having those conversations beforehand with family around their comfortability. And some families are like, yeah, for sure, I love Y Services, I want you to explain what you guys are doing. And then others, they'll ask us to not wear our badge or just kind of introduce ourselves as an informal support.
I just want to add to your question that when kids turn 13 here in the state of Washington, they have the rights, and so we do inform kids and have them sign. And when they learn about that, they're really excited that they can advocate for themselves and like ask for certain things. It kind of varies kid by kid, but that is something that also comes up.
Hello, my name is Aida Villalobos, and I'm a bilingual educator here in Washington State who has worked with in schools with high percentages of students who are coming from other countries. And so my question is, what are some obstacles that you have to get into schools to provide workshops after school, during school, or to present to students? Because I think that in some schools where there's a lot of families who would benefit from your services, that's one of the best places because families normally trust schools. So what are some obstacles that maybe you encounter to get into schools or to be invited into schools?
Yeah, absolutely. So we, as Ys, we do typically try to go into the schools, and we're typically permitted without having too many barriers. I know it definitely depends district to district. We also, again, we try to be out in the community. We try to make our services visible to those who need it. As far as